Today we're going to demonstrate our technique for lower trapezius transfer with an anterior partial rotator cuff repair. In some cases, patients who need these lower trapezius transfers, this patient had severe atrophy of the infraspinatus tendon as well as supraspinatus tendon. We were able to get a small amount of the supraspinatus tendon pulled back. You can see here it's still pretty tight. The posterior aspect, we were unable to get anything back and there was significant fatty atrophy. So we decided to do a lower trapezius transfer. This patient, we're going to do a double row, single anchor, medial and single anchor lateral to fix down the anterior cuff. We've seen really good results in this for our patients. Again, this sort of builds up the entire anterior and posterior capsule. You can see here severe fatty atrophy. Also, patient had a subscap injury, which we fixed as well. You can see here all the fat that we're cleaning off and the significant atrophy as reasoning we're doing the lower trapezius transfer, which we've seen really good results in patients with this infraspinatus atrophy. Again, we're going to clear out this infraspinatus fossa. We've done the lower trapezius identification, and now we're going to remove the fascia. The key here is to go all the way through. You're going to have a clamp, and you want to make sure you open the fascia so you can easily pass the Achilles graft. The graft has been prepped on the back table. See my previous video on this. And then we're going to fix it anterior and posteriorly. In this case, when you're going to do a lower trapezius transfer, we're not going to do it over the top of the rotator cuff. We're going to do it in line or similar with the rotator cuff. You do not need to come as far anterior when you have this fixation, and we've had good results with this in our patients. So we're going to fix the anterior medial aspect. We're going to place a swivel lock, and this is knotless fixation. Following this, we are going to fix the anterior lateral aspect. Here we remove this, you're going to fix the anterior lateral aspect. Now you fix the graft down, and then there are various different fixation methods after this. We've pre-prepped the graft with a more central stitch. We found this much easier to fix. Again, we like to fix the posterior aspect as well. We believe just one anchor is sufficient enough, so we're going to be on the posterior margin. Again, this is going to really pull down this graft and recreate the infraspinatus fixation. Again, we're going to fix this down with a swivel lock. This is a knotless swivel lock, so we have this suture we pulled out. This is the posterior lateral portal. We're going to fixate this stitch that's been pre-threaded. This makes it a lot easier to fix later on and speeds up the case. And then what we're going to do is pass the knotless mechanism. So this usually requires 2 pulls of the suture to get it around. We're going to pull it around the anterior portion, and then we're going to lock it down. You can see here we're making sure that the graft is flush and does not coil on itself. When we use this, we're going to continually tension this. We really like this knotless option. And this is secondary fixation, also brings the graft down nicely. Finally, we're going to fixate the graft to the lower trapezius. You cannot see it here, but on my previous video, you will see this technique. And then we'll leave the patient in a gunslinger for 6 weeks. Thank you.